All right, just move this to the side. All right, I believe. Okay, I think we're all set. So again, welcome to our first live mini workshop. I'm excited to start these out. This is something new that we're trying here on Bump Fit University. And I just want to thank everyone for joining us. And if you're catching this in the replay, thanks for watching. So we're going to be diving into diastasis recti and some common myths that I hear. You know, kind of with the rise of social media, there's a lot of information out there, and there's a ton of information on Dr. Google, as I call it, and it's just can be very confusing. So I wanted to take this time to debunk these myths and kind of set the record straight for all things diastasis. So the first thing is, what exactly is a diastasis recti or diastasis recti? It just kind of depends on how you want to say it. However, I say diastasis. A diastasis is basically stretching and thinning of the linea alba. The linea alba is the connective tissue that pretty much runs from the sternum all the way down to the pubic bone, and it connects the abdominal muscles. It's kind of where they're anchored at. So during pregnancy, it can stretch and widen as the abdominals start to separate to accommodate, you know, your growing baby. And this is a normal physiological process, and that's something that we need to remember. This is normal, it's part of the process. And so at the end of pregnancy, pretty much everyone is going to have it. The second thing that you should know is that you can't really avoid it, but you can certainly manage it. Basically what that means is you might have a kind of predisposition towards it. So genetics is the biggest factor in whether or not someone has a diastasis or how severe that diastasis is. But the other things kind of play a part into it, including the number of pregnancies someone's gone through, how you carry, how much weight you put on. But again, and also age. As we age is going to be another one of those things that will determine how severe the diastasis is. If you think about our bodies in general, as we age, we tend to lose that elasticity. That's why there's so many ads and promos and products out there to keep our faces looking nice and young. And this is because as we age, we lose that elasticity and things begin to sag. So think about it that way as well for the diastasis, that that linea alba is going to get weaker just with age. So those are all kind of the things that kind of play a part into it. You can manage it by making sure that you are breathing correctly, that you're having good posture, that you're being smart in the way that you're lifting and moving your body, including when you exercise. But it's especially important if you have a physically demanding job. It's also equally as important if you already have a little one that you're taking care of, especially toddlers. So just kind of really taking that into consideration, as well as specific exercises to help, you know, combat any widening and separation and weakness. Another thing that you can take into consideration is afterwards, when you're in that postpartum phase, it usually takes 6 to 8 weeks, maybe even closer to 10, for that tissue to be its true, I guess, like end stage, if you want to call it that, meaning I don't test for a diastasis really around 6 weeks and less, simply because your tissue is going to still be very soft. Things are still healing, even though, you know, the checklist from your healthcare provider, your OBGYN or midwife might be over. The diastasis, those tissues, the strength overall is still, you know, healing and getting stronger at that point. So it's kind of pointless it's usually a lot wider at that point as well, versus when you get closer to 10 weeks, that's going to give us a more of a true representation of what that diastasis is going to look like. So a lot of times we call it spontaneous healing, where a person might have had a diastasis initially, but by the time they hit the 6, 8, 10-week mark, they no longer have that issue or concern with them. And number 3, 1 in 3 women have a diastasis recti 1 year postpartum. And that's, just because it's something common doesn't mean that it's normal. So many women are unaware that they even have this. So that's one reason, maybe that's why that statistic is the way that it is. Also, DR can be exacerbated by doing the wrong exercises too soon after birth. So jumping into maybe heavy lifting can cause that, or, a lot of different, maybe like even yoga moves can delay the healing. And then also maybe not doing enough or anything of the exercises can also contribute towards the diastasis not healing, and why some women still have it 1 year postpartum. The other little tidbit that I like to add with that is that it typically takes around 2 years postpartum for a woman to really feel like back to normal, back to where they feel where they were, whether it be like running or lifting heavy, or even if just feeling good overall. So, have some grace on yourself there. The other thing, let's see if I can get this to work here. My screen seems to have frozen. All right, so going on with our first myth here is that it's only a cosmetic issue. And while the insurance companies only look at how they can bill a patient, we're obviously more than a treatment code. And what they don't see is that not feeling comfortable and confident in yourself can lead to mental health issues like depression down the road. So what this means is that a lot of times women, when I see them, they describe it as they haven't even touched their midsection. They don't like to look at themselves in the mirror. Maybe they're sucking in their belly all the time just because they feel like they always look pregnant. They typically will have poor body image as well, and overall they just feel kind of broken. And as a physical therapist, our job is not only to help the physical aspects, but also to support the emotional needs of a client or patient. I know oftentimes I have patients where when they start to release muscles, especially in their midsection, they have an emotional release, they'll start crying. And a lot of times it can be because we carry stress in that area. We tend to really tighten that area. And it can also be from trauma, whether it be from a cesarean, or maybe they had a very traumatic birth experience. So it can be a lot for patients to deal with that. I find that it's helpful to journal through the progress. It helps a lot to kind of just get those feelings out, to kind of write things out and kind of write your thoughts out in that way. It helps to know that progress isn't linear, and this can be discouraging for some. So writing it out and seeing other gains can be helpful. It's not linear because, things happen in life, whether, we get sick or our kids get sick, or we have to leave out of town for whatever reason. And so we don't always put in, 110% on our exercises. And so we don't see those results as quickly as we would like. So it's good to kind of have number goals. So if we're looking at how many fingers fits into my diastasis, how wide is it? You can always look at maybe how you feel, how you look in a picture. And this is something I always encourage my patients to do, is to take a before picture, hide it away and tuck it away into your phone, and then weeks later, you can take another picture and kind of compare those two. And a lot of times that's more encouraging than, looking at a scale, because a lot of times you're not going to notice something in the scale, but you can notice it in the way that your clothes feel, and in the way that, hey, now I feel stronger picking up my kids. I no longer have that type of pain. So The second myth that we're going to be looking at here is that core exercises are off limits. So looking at kind of a simple Google search, and you're going to see that things like crunches and Pilates, planks, bicycle, and leg lifts are off limits. And the truth is that at a certain point, you're going to need to begin implementing these types of exercises to make your core stronger. We can't avoid these exercises forever. Thinking about even just like a sit-up, that's a functional movement that you do every day when you get out of bed, or when you're on the floor playing with your kid, you're gonna need to sit up. So diastasis recti is healing, it's like a balance of positive stress on that linea alba, which is that, again, that tissue in the middle of the gap, so that it gets stronger while at the same time not stressing it anymore and making it weaker. When we're looking at that, we want to look at, I often have a patient do an actual sit-up when I'm evaluating their diastasis. And I do this for a couple of reasons. I want to see what strategy they're using. I want to see what happens in that midline. Are they doming? Are they, coning? Do they even have enough strength to do it? So those are kind of the things that I'm looking at. So I like to look at it is, it's not about what exercises are typically off limits, but rather what exercises can I do while still maintaining good intra-abdominal pressure. So intra-abdominal pressure, just a little segue here, is if you think about like a soda can, you want to make sure that it's nice and contained, right, all the way through, versus if you are squeezing too hard on one end, there's pressure is going to go up or pressure is going to go down. Typically, we don't have pressure going up. The body usually finds the weakest point, and that's typically either a pelvic floor or a diastasis when it comes to postpartum women. So either you're going to put too much pressure and it's going to go down towards that pelvic floor, and things like leaking and prolapse can occur, or it's going to go out towards the front and you're going to deal with things like maybe an umbilical hernia is going to get aggravated, or you see that midline doming. So we want to make sure that things are nice and contained like that soda can. We can also look at kind of the healing journey and what does it look like. Initially, we might start with breathing and posture, just kind of the basics. And then gradually we're adding resistance or weight. We're doing more high impact or demanding dynamic exercises like burpees. Some women start with more intense core exercises sooner, just depending on how well they really can maintain that pressure. And that's what it comes down to at the end of the day. Myth number 3 is gap size equals healing time. So, and that's not always true. So if you can see the screen that we're sharing here, we're looking at, there's 3 basic different points of where a diastasis can occur. It can occur up above. So we're looking at if the belly button or the umbilicus is the midsection. It can occur above that. It can occur below that, or the diastasis can be the whole way through from top to bottom. I typically will see a diastasis happening right around the umbilicus. This is just most people's weakest point. So that's kind of where I find most of them. And that being said, a lot of times people will just check at the belly button, but maybe they don't have that true diastasis at that point. Maybe it's a little further down or a little further up, so they miss it. And then they sit back and wonder, like, why am I not losing weight? And maybe it's not a weight-related issue. Maybe it's you still have that diastasis, so you feel that way, you might look that way, but in reality, you kind of just missed that mark there when you were checking it out. So as a PT, we look at 3 different measurements. First, we look at the width, which is kind of what everybody looks at, is how many fingers can I fit in to that gap, and we look at it above, at the umbilicus, and then below the umbilicus. We're also looking at the depth. So how far down do my fingers sink in? Is it right at the base of my fingernail bed here? Does it go in 1 knuckle, 2 knuckles? Does it feel like it's not gonna stop and I'm just gonna keep on going? So we look at that as well. And then we're also looking at the connective tissue of how that connective tissue feels. Does it feel squishy or does it feel more like a trampoline? And we want it to be feeling more like a trampoline. In terms of function and health, the integrity of the connective tissue between the muscles, or that linea alba, is believed to be more important than the size of the gap. And I know a lot of us are so focused on like how wide is that gap, but in reality, it's more of the connective tissue or that integrity. So when connective tissue is healthy and firm, this allows your core to function well, and the appearance is going to be a flatter stomach. So even if you still have a gap, your muscles are going to look better and your muscles are going to function better if that connective tissue is healthy and firm, more like that trampoline feeling. So again, could that mean that women are focusing on the wrong measurement? We should be looking at more of, how strong that is. And I've seen this a lot firsthand with different patients that I've seen. I've had patients where I can fit both hands and then I feel like I still need more fingers to kind of get a true feel of what's going on. And it can be very deep. It can be feel like it's never going to stop, that they're just going to keep sinking in. And then I've had patients who have also had a very tiny diastasis, maybe less than 2 fingers, but it also feels deep. So which one is actually, are they just equally as severe? I've also had patients who have had a wider diastasis, but then it remains nice and firm and shallow. And at that point, technically, you could still have a diastasis just by the fact that there's more width between the muscle bellies there. But we would call that more of a functional diastasis, meaning you're still getting full function of the abdominal muscles. It's just the gap maybe isn't closing all the way, whether that means you're still early on in your healing journey, or it could be also that it's taking longer just because of those factors that we talked about initially, which is the age and how many pregnancies you've had and how you carried and all those things. So a lot to take in from that. The fourth one is that a diastasis doesn't always cause the back pains and pelvic floor symptoms. So abdominal separation in itself is actually painless, and it will cause, but it will, let's put it this way, it won't cause the symptoms, but it can contribute towards things like low back pain and pelvic floor symptoms. And this is due to weakness in the transverse abdominis. This is due to postural changes, breathing patterns change during pregnancy and after pregnancy, and also obviously with like past medical history. So if you've already been dealing with a like back pain from beforehand, and then you have the diastasis, then you can't say necessarily that it came from the diastasis. At least that's not how it is with my patients who come in. A lot of times they'll come in specifically just for diastasis. There's no other symptoms, whether this be that they have a very wide gap or a very narrow gap. It doesn't really matter. It's just, two separate things. Definitely the weakness in the core can contribute towards things like the back pain and the pelvic floor symptoms for sure as well. And then our fifth fact here, or fifth myth, is that doming is bad. So if you look at social media, for example, especially with the rise of social media and influencers, they're all going to be telling us that the doming that we see is bad. And, if we Google it as well, that it's going to tell us that we want to stay away from that stuff. But doming isn't necessarily a bad thing. I don't want to look at it that way. Doming is actually our body's way of telling us how we are managing that intra-abdominal pressure. So we typically want to avoid firm doming of the abdominals, and this is because it's telling us that activity that we're doing is causing more of that intra-abdominal pressure that we discussed than that we can handle. Versus sometimes people will have soft doming, meaning like it still domes up when you do like a sit-up or a crunch, but typically that deformation that you see there, that doming, is loose skin, or it can be fat, or even over recruitment of some of these muscles. So again, it's not necessarily something, to kind of shame our bodies for. It's actually, communicating with us on how we are doing that. So it's a good indicator, especially if you don't necessarily see it with a sit-up, because maybe you've already mastered that. If you were to do something like a pull-up, then that's something usually when you can see that doming happen. It's especially harder to determine this when you're pregnant because things are already kind of out there. But one of the ways that I kind of looked at it is when you're trying to sit up, or actually rather lay back at an OBGYN's office and they're trying to examine you, they tell you to go ahead and scooch back and lay on that reclined table. And that's when I was like for sure able to see it. It's hard to kind of roll on your side and lay back there when the table's kind of narrow, or if you're not necessarily going in with a partner, you don't want to necessarily roll off the table. So that's where I would notice it. The other time that I would notice it during pregnancy was actually when I was pulling up my pants after using the bathroom, and that was either just because of the material of the clothing, because it didn't happen every single time, but the material of the clothing, if I was trying to hoist up something that was more like tighter fabric, like leggings or something, then I would notice that doming, and that was just because either I was holding my breath and not even knowing about it. So again, just my body's way of telling me it was just a little too much pressure for me to handle. So I know that was a lot of information, but just know, biggest takeaway is that it's never too late or it's too far past your pregnancy to address a diastasis. You can start whether you're 6 weeks postpartum or you're 20 years out. I've seen patients on both ends of the spectrum, and it's never too late to start with something like that with your road to recovery. So we did it. We did 5 myths. I wanted to keep this sweet and short. I know we're all very busy, but I hope that this mini workshop gave you some valuable information on diastasis recti, and then kind of, shed some light, and maybe you're not as nervous about tackling this from here on out. The reason I like to hop on here is so that we can also know a little bit more about what we do, how we serve others. And if this is something where your interest was piqued, if you're wondering if, maybe we can do a little bit more, or you simply want to know more, you're a little bit curious about kind of what we do and how we help out, clients and patients. There's 2 different ways that you can work with us. The first step is you can, text me, or not text me, but like direct message me or email us, and we can find a time to chat and know a little bit more about like what your symptoms are, what you're dealing with, and kind of, guide you as to what is the best course of action for you. Is that more of a group, self-led, independent program, or would you benefit more from a one-on-one guidance? Certainly there's benefits from both sides. If you're wanting more of that independent, you do it on your own time. But if you're needing a little bit more guidance, you're not 100% sure if you're doing the right things, if you like things that are a little bit more customized to your specific needs, if you need someone to give you that little extra push to hold you accountable, then for sure, we can set up something for a one-on-one capacity there. So if you're looking for more of a, just kind of call, that no strings attached call, you can just DM me with the word call. If you're wanting more of that self-guided independent program, you can DM me the word guide. And then if you're wanting to do a little bit more with that one-on-one, you can DM me the word core. So again, otherwise, we're here to help you out, support you in any way that we can. And if you're catching this on the replay, let us know in the community what you took out of it. We want to know your wins, and we want to know your gems, and we just want to know how we can help each other out a little bit better. All right, thanks for joining in.